Hello, everyone. Hope you are all doing well today, and our presentation is about the coronavirus. So, the coronavirus has been a topic that has been talked about quite often for the past few weeks now. We are all under lockdown, and we didn't expect this to happen, but it is a huge pandemic, and we all need to be safe. So the public health officials have made this an emergency issue and have told everybody to stay home, and so many schools have already been closed, and so many businesses are shut down as well. The coronavirus first started from a human seafood market in China that apparently an animal had this certain virus and transferred it to a human, and human infection so many people, and it spread to the capital of China's Hubei provinces. In the beginning, there was an article talking about how certain face masks should be worn for the virus, but we have reached to the point where once we leave our homes, we all need to wear face masks to protect ourselves from the bacteria, especially if we're going to the grocery stores and workplaces that are still open. Nurses and doctors have been working so hard to treat so many patients that have been diagnosed, and they are also very scared because they are putting their lives out front and risking their lives in catching this virus. In this map, we see states that are reported cases of COVID-19, and this is an updated map that I just pulled up from the CDC on April 11th. And as you can see that so many states have been infected and so many people are suffering. On our left-hand side, we get to see that the total cases in the United States and the total deaths that we've had. These numbers are rising very quickly, and all we can do is social distance ourselves and stay home.
Why this is a global health problem. This is a global health problem because COVID-19 is causing people to die at large rates if contracted, and it's also spreading very rapidly. A lot of people believe that it wouldn't be spreading as fast as it is. And as Angelica mentioned in the previous slide, she showed a picture of the COVID-19 cases happening in the US, but we need to realize that this isn't just happening in the US. It's happening in the entire world. And because of this, it's causing a lot of deaths, and this is causing the population to be reduced at immense rates. Also, another thing is that a lot of people are not taking this whole COVID-19 seriously. At the beginning, a lot of people didn't take it seriously. They didn't follow the stay-at-home act. They weren't social distancing themselves properly. They're not out wearing the face mask that they need to wear, or maybe even gloves. And then we also need to realize as well that this virus doesn't discriminate against who you are. You can be rich, poor, African American, Hispanic, Latino, it doesn't matter. If you contract this virus, it's very scary because a lot of the times it does mean death. Implications to the general public. A lot of people need to be aware of this sickness. A lot of people need to be aware of the people that are sick around them, and they need to take this very seriously. And something that is made to the public is that education about this disease is very crucial. People need to understand that this disease shouldn't be taken lightly. Also, another implication made to the general public is that all hands are on deck on trying to combat the coronavirus. A lot of people are working together, and we all need to work together from the highest level to the lowest. We need to work all the way from the government all the way down to the general public, anything in between that as well. And they also do make it very clear that the coronavirus is very deadly. They make that very clear in the news, social media, and now this is considered a pandemic. This is infecting the whole entire world. And then a lot of things that are being made to the general public as well is that they're providing education. Just like I said, they're providing education through social media, on the news, and stuff like that.
The two agencies that have been working with coronavirus is World Health Organization and Global Health Now. World Health Organization is a specialized agency by the United Nations, and they take part in main courses of the world and see what they can provide information for public health and how to solve these issues and deal with it. Global Health Now is a non-for-profit organization that keeps up-to-date public health news and wants to inform the public about the important information that they should know.
Interventions by agencies. So some of the interventions that both these agencies are working to provide for the general public is the general education of the coronavirus, They're providing education on the effectiveness of face masks, the proper face masks to wear that works best against the coronavirus to works the least to the against the coronavirus. They also are giving education on the effectiveness of gloves, proper way to wear gloves, proper way to dispose of gloves, and stuff like that. Also, they are working diligently on a vaccine, though a vaccine has not been created yet. They are working very hard on it. Another thing is the Stay at Home Act. The Stay at Home Act is actually a great thing because we're learning social distancing, although it may be hard, and all of us are going through this and know that it is very hard. But this Stay at Home Act is the best way to combat against the coronavirus and slow the spread. Also, they are making sure that people must wear face masks at all times. They do have a curfew system per se. Let's say you're not considered an essential worker, so if the cops do pull you over, they will give you a ticket or they will give you a warning, but you must be home. Also, another thing is that only essential workers should be working. So right here in this picture shows the infrastructure of critical essential workers. Some of the essential workers are communications, healthcare and public health, of course, we see that. Transportation systems, food, of course, we see that as well because we do need our groceries and stuff like that.
The Global Health Now provides so much information on their website about what they can do about the coronavirus and new updates that they have, and trying to receive new information to provide us. Their main concern is educating the public and providing information about the extended Stay at Home Act that is now reached till May 15 and may prolong for a longer time. World Health Organization just released with the United Nations $15 million to the coronavirus in order to help make new masks for everyone, to help nurses and doctors with their gear, helping people that are suffering with this virus and trying to find a vaccine. So most of the money has went towards the vaccine to try to help find a cure, and they're trying to keep the population safe and help eradicate the spreading of this virus.
Thank you for joining in on our presentation, everyone. I hope you enjoyed it. And this slide right here just shows our references that we pulled and got our information from. Thank you again. I appreciate it.